Operations suspended at Phoenix Medical Facility, and tonight we're taking a closer look at what's becoming an absolute healthcare horror story. The state ordering St. Luke's Behavioral Health to shut down over health and safety concerns. ABC 15's Marissa Sarbeck following up for us tonight, speaking with a former employee.
Katie, that former employee talking to me about the issues described in the Department of Health Services report from August 9th. But she says some of those issues were going on much longer than the state noted.
On my unit alone, and it was evident throughout the hospital, air conditioning, it was very inconsistent. My office was freezing, but if you walked to a different part of the office or a hospital, it was hot.
Cassandra Baizon says she started working at St. Luke's in Phoenix as a therapist in social services in late 2021, detailing what she says were inconsistencies with the HVAC units 3 years before last week's HVAC failure, suspending hospital operations. The state health department stepping in, noting the temperature the morning of August 9th at 99 degrees inside the lobby, with 72 patients inside, including 22 children and teens. A current employee who wants to remain anonymous telling ABC 15 the AC went out the day before. The behavioral hospital confirming the last patient was transferred out of their facility on Saturday morning. Cassandra telling ABC 15 she was terminated from St. Luke's in April of this year after raising concerns about what was happening there.
That kind of flooding happening throughout toilets. When that floods the units, it goes out into our hallways, which have carpet. And I don't remember, and I could have missed it, but I don't remember any hazmat cleaning crews coming out to clean the carpeting.
Claims of unsanitary conditions echoed in the DHS report this week, noting a dirty kitchen, lack of cleaning supplies, open drains and vents, and patient food that was expired for more than 2 months. ABC 15 looked and found a previous investigation by DHS on June 26th, but the paperwork shows no deficiencies. So we asked how, less than 2 months after receiving no infractions, is St. Luke's now facing a long list of them? The statement ignored our questions, but reads in part, quote, "We and our sister agency, AHCCCS, were on site immediately to assess the situation, including the condition of the facility and the care being provided to patients."
It's really rare to have an immediate suspension like this. So my first reaction was, this licensee must have been super non-responsive for the state health department to end up immediately suspending their license.
Will Humble, the former director of ADHS, weighed in, calling it a dramatic move to suspend the facility's license immediately, but not a knee-jerk reaction.
It wasn't just that the AC was broken, but that they, for a period of days, were unable or unwilling to fix the environmental conditions that were jeopardizing patient care.
We asked Steward Health, the parent company of St. Luke's, for an on-camera interview Thursday. We did not hear back. A statement released by the company on Wednesday cites that patient care and safety is at the forefront of what they do. Reading in part, quote, "We are alarmed at the state of Arizona's arbitrary decision to force St. Luke's Behavioral Health Center to suspend operations and halt patient care." Now, there is a hearing regarding the future of operations at St. Luke's set for August 29th. We know the state is trying to get their license revoked permanently. All of this swirling after the parent company of St. Luke's, Steward Health, filed for bankruptcy back in May. Katie?
Oh, these patients matter, and we'll stay on this.